We will now be seeing about low vision aids. In this session, I will describe the various types of low vision aids and explain some procedures in the use of these aids. The low vision aids are broadly classified as optical aids and non-optical aids. Before selecting the low vision devices for the person with low vision, make sure the person has been examined by an ophthalmologist and see if spectacles are needed to correct or improve vision. As an ophthalmologist, we learn about their family history, medical history, ocular pathology, and the present need of the person with low vision because it is necessary to understand the individual as a whole. The selection of the low vision devices will vary based on their age, nature of work, and need of the person with the low vision. It is important for a person with low vision to wear glasses to correct the refractive error if they are nearsighted, farsighted, or have astigmatism. If a child is not using the refractive correction, it will affect the child's functional vision, which impact their educational performance and overall development. We will first learn a few technical terms to understand the low vision aids better. What is magnification? Magnification is the process of enlarging something like an object or print only in appearance, not in physical size. The aim is to stimulate more retinal cells, allowing an image to be perceived. The magnification is attained through 4 ways: relative distance magnification, relative size magnification, angular magnification, and electronic magnification. Relative distance magnification. Relative distance magnification is where a proportional enlargement of the retinal image on moving the object closer to the eye happens. Example, sitting in front of the television or holding a book close while reading. This is also called the approach method. Relative size magnification. This is achieved by enlarging the size of the object to give an enlarged image on the retina. Example, large print books, writing large letters. Angular magnification. Angular magnification is achieved by enlarging the image with the help of an optical system. Example, telescope or magnifier. Electronic magnification. Electronic magnification is where the enlarged image of the object is viewed with the help of an electronic device like closed circuit camera. Low vision aids. Most children with low vision can significantly increase their near visual acuity by employing their strong ability to focus on nearby objects or by squinting to produce a pinhole effect if they have poor accommodation. Children with low vision normally achieve the required magnification by the approach method, that is, the relative distance magnification. Some children need optical devices along with relative distance magnification to see the target clearly. The low vision devices can be grouped into 2 categories, optical and non-optical. Optical devices. The optical devices improve or enhance the residual vision by magnifying the image of the object at the retinal level. Optical devices are useful to increase the distant and near vision. Near vision devices are designed for magnifying the objects and print close to the person. Distance devices are for magnifying things in the distance, that is about 3 meters to far away. Near vision optical devices consists of hand magnifier, stand magnifier, and spectacle magnifier. Telescope helps to improve distant vision for persons with low vision. We will now see the optical devices that help in near vision and also how to use them. The optical devices near vision. The first device that we are going to see now is the hand magnifier. Hand magnifiers are handy and easy to use. These are convex lenses mounted on a handle. It has to be used at the focal length of the lens. Higher the power, heavier is the magnifier. It is an excellent device for spot viewing and are available as self-illuminated and LED forms. These are inexpensive and readily available in the market. The disadvantage is that one hand is always blocked while using it. It is not useful for prolonged reading. Hand and arm fatigue is found to occur with extended use, especially in children and persons with hand tremors. How to use it? The reading material has to be kept at a comfortable distance. Then the magnifier is brought near to the print and gradually moved in towards the face till a clear image is seen while trying to read the text through the magnifier. This is the best distance to read the text. One should try not to change the distance between the magnifier and the text till the reading is complete. Stand magnifier. The next optical device is the stand magnifier, where a high power lens is mounted on a strong plastic stand. It is useful for children as it has a fixed focal distance. Children with low vision will get comfortable posture if it is used along with reading stand. This is useful to the person who has difficulty in finding or maintaining the correct distance. Example, children or person with hand tremors. These are available with built-in light source, which can be highly effective in enhancing the contrast. The usage technique is also very simple. We have to place the stand magnifier on the reading material and move it across without lifting it from the page to be read. The advantage is that there is no need to adjust the focal distance as the lens is fixed on a stand. Spectacle magnifier. Spectacle magnifier will not be useful for the children as the working distance is close to the eye. It is not useful for prolonged reading as it has closer working distance due to the higher power. When using spectacle magnifier, the reading materials is first placed at the focus distance as advised by the professional, and the same distance is always maintained. When you begin to use reading spectacles, the eye needs more time to accept the power of the lens. So, we ensure that the patients gradually increase the reading time in order to reduce the strain. Another important factor to be kept in mind when using a spectacle magnifier is the lighting. Closed circuit television (CCTV), when these traditional optical low vision aids do not help to accomplish a task, electronic aids might help. Closed circuit television (CCTV) helps people who need greater magnification than reading glass and magnifier. It allows the person to adjust the size, brightness and contrast of the magnified image. The person can even read white letters on a black background to decrease the glare. CCTV is more expensive and far less portable than other near vision aids. The electronic video pocket magnifier. Yet another electronic device is the electronic video pocket magnifier. It works like a portable CCTV and has a wide magnification range. The person can change the background in 20 to 30 different modes. A freeze mode option is available for capturing the image for easy viewing like a digital camera, and nearly 200 images can be stored. The person with low vision can transfer these saved images to the computer with the help of a USB converter for easy viewing. The distance viewing feature is also available in some of the advanced electronic video pocket magnifiers. We will now have a look at the devices that aid in distant vision. Telescope helps the people to improve the distance vision. Objects appear to be closer and it is hard to judge distances properly, so it is best not to use telescopes while walking around. Three types of telescopes are available. They are the clip-on, handheld and the spectacle mounted. The clip-on telescope allows the user to clip the telescope over the glass for hands-free use, and it can be used for extended periods of time. Handheld telescope is a monocular type of telescope and provides a quick view of distant objects. It is useful for spotting purpose like reading the sign or name board. The disadvantage is that the patient has to hold the telescope in their hand, so it is difficult to use for the children. Spectacle mounted telescope is mounted on a spectacle frame and can be used for longer periods of time. However, the field of view is smaller compared to other models. It is useful for children with low vision for doing blackboard work. The telescopic eye can be used for reading the blackboard letters and the other eye can be used for writing. Bioptic telescope. A bioptic telescope is a special pair of glasses with a telescope permanently mounted on the glasses while looking straight ahead. A bioptic user sees a normal unmagnified image through the glass. Then by dipping one's head slightly, the bioptic user instantly sees a magnified image through the telescope. This bioptical system allows the user to rapidly switch between a normal view and a magnified view without ever using his or her hands. A person with low vision can also use bioptics in the same situations he or she might use a handheld telescope, such as seeing a classroom blackboard. Hands-free use can help students to take notes in class more quickly and easily. Some bioptic users prefer telescopes in both eyes, while many users with low vision choose to have only one mounted telescope for their dominant eye. So how to use it? First, spot the object or place we wish to see. Then bring the telescope near to the eye with stronger vision and then focus. When looking at the blackboard, if unable to spot the writing, follow the horizontal and vertical margins of the blackboard and then start focusing. Begin by focusing on the first letter of line 1. Then move the telescope to the right and read the line until it has been finished. Before starting to read line 2, bring the telescope back to the beginning of line 1 and then move the telescope downwards to the beginning of line 2. Then proceed to read line 2. Follow the same instructions before beginning to read line 3. This technique will ensure that the student with low vision do not skip reading lines. Non-optical devices. In non-optical devices, lenses are not used like all low vision devices, and the aim is to make low vision people's lives easier. They are designed to promote independent living. We will now discuss about each device one by one. Reading stand. It is used to hold the reading material in a comfortable position so that the patient can read without straining the neck and back muscles or tiring the arms. Adjustable lamp can also be added to help reading for extended periods. It is used to reduce the distance between the object and the reader. The next device is the felt-tipped pens. Contrast is important for people with low vision. Hence, it is wise to use pens which make clear and bold marks. A black felt-tip pen on white or light colored paper is usually the best. The amount and direction of light are important for best visual functioning. Lamps or good room lighting can help to improve visual functioning. Light should be adjusted on the printed material and should not reflect in the eyes. A reading guide. A reading guide which is put over a page of print is often helpful for a person with low vision as it reduces the glare from the page. It is also easier to find and keep the place while reading. A reading slit can be made by cutting a hole in a rectangular piece of cardboard. The hole should be big enough to uncover one line of a print, approximately 1 cm high and up to 15 cm wide. The next device is a typoscope. Typoscope is a black cardboard or a plastic sheet with a window cut out. This will block out all other lines except the one that is being read or written. The black surface also reduces glare on the printed page and improves contrast of the letters. Typoscope can be made out of cardboard and black paper. Varying sizes of typoscopes can be constructed for different books or papers. The next device is the writing guide or letter writer. The writing guide or letter writer is like a folder with rectangular slits. A sheet of paper is placed inside it for writing. It helps the person with low vision to write in straight lines without any glare. Even children with normal vision who have problem in writing in straight line can use this for training purposes. The next device is a notex. It is designed to identify currency notes. It has been designed exclusively for Indian currency. It is a rectangular black sheet and has 6 cuts of different length. These 6 cuts indicate different currency notes. Example, the first cut indicates 5 rupees note. The second cut indicates 10 rupees. The last 6th cut indicates 1000 rupee note. Rupees 20 and 50 have same length. In order to differentiate, notex has a single cut at the bottom. By the breadth of the note, the person with low vision can easily differentiate 50 and 20 rupee notes. Large print books may provide comfort for those children who cannot read regular print at a close distance even with an optical aid. Spacing between letters and lines is also important. Bold line paper. This paper has dark bold lines and it is helpful for children who find it difficult to see the lines on a regular writing paper. Bold lines are available in various formats such as graph paper and large print staves for music notation. Person with low vision can use computer as like a normal person with the help of special software like screen readers and screen magnifier. Magnification can be changed even in common software. This can be done in a variety of ways such as directly changing it on the toolbar or using options like magnifier or narrator. Important factors for the successful prescription of low vision devices are as follows. The successful prescription of low vision devices for all children is dependent on a good knowledge of a child's case history and of the diagnosis and prognosis of his or her eye disease. Appropriate techniques should be used to obtain detailed information on children's refractive errors and visual abilities. The practitioner should also have a good understanding of the functions and features of the various low vision devices, and he or she should know how to select and apply the most appropriate low vision devices for the children to accomplish their various visual tasks. Training in the use of low vision devices is critical and home trials of low vision devices are advisable. These should be arranged immediately after the initial assessment. Children should attend their first follow-up visit 3 to 6 months after their initial assessment. This will ensure that they have enough time to try the prescribed low vision device at home and at school. Because visual requirement changes with age, children should attend follow-up visits once in 6 months. The children accept the low vision devices more readily than adults and with a higher rate of success. They tend to use more than one device depending on their requirements. Good communication with parents and teachers is important in order to maximize the successful use of low vision devices. Parents and teachers should be encouraged to note difficulties when using low vision devices, especially during the first home trial. The children may complain the following while using the low vision devices. Head and neck pain after using low vision devices for a long period. Difficulty in finding the image due to the smaller field of view. Shadow cast by the low vision devices on the print being viewed. Using an unusually close reading distance. And no improvement in viewing with the low vision device or no reduction in fatigue. This information should be discussed in the follow-up assessment. It will allow the practitioner to provide appropriate recommendations. There are a few misconceptions about vision loss that needs to be changed. Holding a book close to the eyes will not harm vision. This is often done by individuals with visual impairment to help compensate for the size of the print. If a television is functioning properly, Sitting close to the set will not harm the eyes. Sight cannot be conserved. Hence, unless you have been informed otherwise, encourage the child to use his vision. Not all children need extra lighting. As a result of some eye conditions like aniridia, corn dystrophy, albinism, or corneal disorders, a child may require dim lighting in order to visually feel more comfortable. Using low vision devices will not improve the child's vision in future. With the help of low vision devices, the child can do better and visually feel more comfortable. How can the teacher help the child feel comfortable in the classroom? Introduce and address the student with visual impairment by name as you would do to any student. Seat the student away from the glaring lights and preferably in front of the class. Use descriptive words such as straight, forward, left, etc. in relation to the student's body orientation. Be specific in the directions and avoid the use of vague terms with unusable information such as over there, here, this, etc. Include the student with visual impairment in all activities. The teacher of the visually impaired can offer suggestions like the methods and the special equipment or aids which may be helpful in doing some activities. All children like to be the center of attention. Encourage the student with visual impairment to take leadership positions just as other children do. Encourage the child with the visual impairment to move about the classroom to obtain his or her materials. He or she will know their own needs and the method of compensating, and they will soon become part of the classroom routine. All children are sensitive to peer criticism. Your own acceptance of the child with visual impairment will serve as a positive role model for the class. It is very important to educate students and staff members in the school about matters concerning a visual disability in order to better manage the behavior of students or other negative comments which can have a detrimental impact upon the self-esteem of the child with visual impairment and cause depression. The student with visual impairment may bring adaptive aids into the classroom. Encourage him to use these aids as and when needed. Because some visually impaired children prefer not to bring attention to their disability, they will use special aids and assistance from others only when absolutely necessary. In general, you should respect the child's wishes, but if you suspect the child really needs more aids or assistance than using, you may consult with the teacher of the visually impaired about this. For the safety of the student with visual impairment as well as for all other children, the doors and cupboards should be all the way open or all the way shut. He or she should also be told of any changes in the position of the classroom furniture. To conclude, there is a lot of recent advancement in low vision aids which will help the people with low vision or visual impairment to live independently. Each low vision aid has its own advantages and limitations. Since different aids help with different tasks, the professional should help the person with low vision in the selection of low vision aids to accomplish all of his or her goals. Tasks, goals and technology change over time. So it is important for the person with low vision to periodically re-evaluate the low vision aids he or she is using.